Hello everybody, today we're going to see the unboxing of Abbott Cholestech LDX Analyzer, which is primarily used for the analysis of lipid profile, cholesterol and also the glucose testing. This is how the total machine looks like. You can see the carton box. Whenever you order this machine, along with the machine you get the universal printer, and also you get the adapter for the printer and this printer cable connect along with the paper roll actually. So this is this total kit you get whenever you order the Abbott Cholestech LDX Analyzer. So probably I'll just open this one by one for you. You can see this is how the box looks like. You can see this here. It's a CE-IVD certified product for professional use only. This is a point of care testing that is help you to completely check your lipid profile, cholesterol and also the glucose. So you can see the other side of the box. You can see it says Alert San Diego Incorporation from US. This is manufactured in the US. You can see the other side, and also I'm showing you the other side. You get the part numbers and also the details. Okay, this one I'm going to open this for you. Okay, got this open. Inside you can see, inside the box you can see there is one paper. Okay, I can get this open. You can see that it says the certificate of warranty. There is a warranty document that comes along with this box, so you get a complete details in the warranty document. I'm just keeping it aside. And further, if you look at, there is a complete user manual. You can see this says Abbott Cholestech LDX system user manual. So you get the complete user manual that can help you to run the mission and also do the necessary maintenance related information and complete guidelines. And this is how the inside the pack. I mean, you can see that the LDX Cholestech Analyzer is completely well packed. You can see that there's a sufficient cushion, and whenever to manage the transport, it's well packed. I'm just going to pull this out for you. Okay. Opening this out. Yeah, okay. Okay, I'm just got this open. You can see this inside. You can see. Yeah, okay. I think we have the mission. There is a mission, and also there is another box to it. I'm going to open that too for you. Okay, you can see this cushion. So I'm keeping it aside. Okay, and I left the box aside, and you can see the mission here. Okay, you can see that the mission, it says Cholestech LDX Analyzer, about point of care mission. You can see how the mission, I just show you around the mission. You can see this. You can see this here. It says C certification and also the cable points, the data printer connection points. So you have the complete details here. This is how the machine looks like. I'm just showing it again. It's completely stretch wrapped, so I'm not going to open this stretch wrap. I'm just showing it as it is. You can see this here. Then inside the box you also got another box. Okay, here it is. And here you can see there's a power cable. I think power cable with the different adapters. It looks very nice. You get the different adapters here. You can see. Okay, you can see there is a power. Okay, this is the box. You can see there is 100 to 240 volt power supply LDX International. You can see this is used in any country. You can use this. It has a complete power range adapter. So from you can see. So there you get an adapter. You get an adapter. Along with that, you get different plug points. I mean, almost you get 4 types of plug points to match with based on the country power plug points. This is it. Okay, if you look at, just quickly to summarize here, from the Abbott Cholestech LDX Analyzer, inside the pack you get one mission and one user manual and a warranty sheet, and there is a power adapter box which has 4 different adapter plugs that can fit in different countries to meet the power range. So this is how this box looks like, and what I'm going to do is I'm also going to open the printer that comes along with that. Okay, let me open the printer for you. I'm just going to show the printer box. As I said, you get a universal printer along with, whenever you order this Cholestech LDX Analyzer, you get a universal printer along with that. You can see the reference part number of the printer. and along with the printer you get the printer power cable, and you get you can see this here, you get the roll for the printer, and there is another kit which says the printer cable kit DB9 connector. You can see the DB9 connector, you can see this here, you can see the cable. So let me open this, I can just show you around the, okay, you can see this printer, you can see this printer, the part number is 551115, you can see this here, so everywhere it's written the part number, you can see the weight. Okay, I'm going to open this for you. Okay, got this open. Okay, you can see the inside. There is a CD. There is a CD along with there is a user manual. Okay, for the printer you get along with the printer you get a CD-ROM, and there is a manual inside. Okay, let me open this for you. I'm trying to pull this out. Okay, I'm just taking this out. I can show you that there is a CD-ROM. There's a CD-ROM for the printer, and there's a packing list that shows the universal printer. You get a paper roll shaft and a CD-ROM and a power cord and the user manual. Okay, I think we got the packing list sheet also here. You can see the printer user manual. You can see there is a complete details is given in the user manual. You can see the user manual, and there is another sheet. Okay. There is another instruction sheet and the user manual here and the CD-ROM. Okay, there's a packing list. Then let me get inside the box. Inside the box you will get another adapter, and I'm just there is a shaft, as I said, there is a shaft inside. You can see there is a shaft inside. As per the packing list, you also get a paper roll shaft. I'm keeping the paper roll shaft, and then I'm going to put the machine outside. Okay, I put it here. Okay, just move this. Let's take this off. Okay, and I'm going. This is how the printer looks like. There's a cover for the printer. Let me take this off nicely. I'll show you the printer. This is how the printer looks like. Okay, I can show you around the printer. It's easy to just I'm holding in my hand. So lightweight. You can see the power options back in the back side. You can see this here. It says LR Universal Printer. Okay, got this. Okay, in the printer box and along with the printer you get this LR Universal Printer manual, and you get one CD-ROM Universal Printer software, and there is a roller shaft, and there's a packing list. There's a power adapter, and also there's another power adapter cable to connect to the system, and then you get a printer cable kit DB9 connector and the roll. Just quickly to summarize here, let me organize this and tell you what all we get. Okay, I'm going to do this. Okay, here you go. I'll just keep this aside. Okay, just quickly to summarize here, today we have seen the unboxing of Abbott Cholestech LDX Analyzer that is used for your lipid care, cholesterol and glucose analysis. So in the Cholestech LDX Analyzer pack, you get one mission and one user manual, and there is a power adapter box that gives you the power adapter range along with the different plug points, and then one warranty sheet. And then in the printer universal printer set, you get the one printer, and then you get a power. There's another power cable and the main power cable to the system, and then you get the paper roll shaft, and then the packing list, and then you get a paper roll and the printer cable kit. This is how the total test kit, the machine looks like for the Cholestech, Abbott Cholestech LDX Analyzer. Thank you. Thank you.
Part 1. System Overview. The Cholestech LDX system uses reflectance photometry to measure the concentration of blood analytes such as cholesterol or glucose. The analyzer is easy to use and can be operated by pressing the 3 buttons and following the instructions on the LCD screen. The Run button opens the cassette drawer and starts a test after the cassette is inserted. It also resets the analyzer to prepare for the next test. The Data button allows the user to view the last reported results and to obtain any calculated results. The Stop button closes the cassette drawer at the end of a testing period and allows you to interrupt a test that is in progress. The Cholestech LDX system uses disposable, single-use test cassettes that have 2 parts, the main body and the reaction bar. The main body contains the sample well, where the blood sample or control is dispensed, and the brown magnetic stripe. Once the sample is dispensed, it flows through the center glass, which separates out the red blood cells. The plasma is then transferred to the reaction bar to test specific biochemical reactions. Within minutes, the white pads on the reaction bar change color. This color change is read by the analyzer and interpreted into a result. The brown magnetic stripe is read by the analyzer and provides information on the type of cassette, the product expiration date, and cassette calibration. Avoid touching the brown magnetic stripe and the reaction bar. Part 2. System Setup. The Cholestech LDX system is shipped in a specially designed packing box, which protects the system from damage during shipping. Abbott recommends storing the analyzer and printer boxes and using them for future shipment needs. Before you begin testing, be sure to have the appropriate blood collection and infection control supplies available. In addition to your analyzer and test cassettes, you will need the following items that come with your Cholestech LDX system: lancets for capillary blood collection, Cholestech LDX capillary tubes and plungers, and mini PET pipette and tips for running quality control material or venous samples. You will also need the following items: alcohol, swabs, and gauze, quality control material, medical gloves, biohazard waste containers, vacuum collection tubes, needles, and tube holder if a sample is to be collected by venipuncture. For venipuncture samples, please refer to the package insert for the appropriate type of vacuum collection tube. The Cholestech LDX system works best in a normal, comfortable environment. The system should be used at room temperature between 68 and 87 degrees, or 20 and 31 degrees Celsius, in a dry location between 20% and 80% relative humidity and away from direct heat. It should always be operated on a stable tabletop surface protected from direct sunlight and free of instruments that may shake or vibrate, such as a centrifuge. There are several features of the Cholestech LDX Analyzer, and we recommend you become familiar with all of its features. In order to upgrade the software of your analyzer, you will need to replace the ROM pack. Be sure you disconnect the analyzer from the power source. Then remove the clip before removing the ROM pack. Failure to disconnect the power source before removing the ROM pack could render the analyzer inoperable. When using the optional printer to record results, plug the printer cable into the printer port just above the ROM pack. Then plug in the power adapter cord. Plug in the printer cable to the printer and tighten the screws. Plug in the AC adapter. The power adapter should be plugged into a standard outlet where the circuit won't be interrupted during use. Abbott provides appropriate power supplies for international use. Part 3. System Configuration. After plugging in the Cholestech LDX Analyzer, the words Testing Memory will appear on the LCD screen. The analyzer will run a self-test, which ends with the message Self-Test OK. After a brief warm-up period, your analyzer will be ready for use. Before you start using your analyzer, it is recommended that you set the information in the Configuration menu. To enter the Configuration menu, hold the Stop button down until the firmware version appears. The Configuration menu allows you to make changes to how the Cholestech LDX system shows information such as language, units, sample type, LDL-HDL ratio, printer option, CHD risk assessment, date and time. For each configuration setting, press the Data button to review your options, and when your choice is shown, press the Run button to set, and go on to the next menu item. The first screen in the configuration menu, Lang for language, will appear. The language options are English, Italian, Spanish, German, and French. The second screen displays units of measurement for the test results. Options are milligrams per deciliter and millimoles per liter. The third screen displays sample for venous whole blood or capillary whole blood sample from a finger stick. The sample type should be set on whole blood, whole B. This sample type should also be selected when running the multi-analyte controls. The sample type should be set on serum when running calibration verification or proficiency testing material. The Cholestech LDX system is only CLIA-waived for fingerstick or venous heparinized whole blood for test cassettes that have been classified as CLIA-waived. The fourth screen reads LDL-HDL with the options Yes or No. This option allows you to toggle the reported results between LDL-HDL and TC-HDL ratios. No is the default setting. When set to No and a cassette with TC and HDL is run, a TC-HDL ratio will be calculated and reported. The fifth screen reads Printer with the options On or Off. The sixth screen asks for the number of labels to be printed with the options of 1, 2, or 3 copy or copies. The seventh screen is for CHD risk assessment. Choose CHD risk to run the risk assessment or off if you choose not to run the CHD risk assessment. The eighth screen displays the day of the week, month, date, and year. The ninth and last screen displays time, hour, minutes, seconds, and AM or PM. Please note that when English is the selected language, AM or PM is displayed. When any other language setting is selected, the hours are automatically shown in the 24-hour format. Press Stop to exit the configuration menu at any time after you have made your choices. Once the configuration menu is set, it will not change unless you enter the menu and make changes to it. The internal battery will maintain your choices in the event of a power interruption. Part 4. Optics Check. There are 4 optical channels inside the Cholestech LDX system. An optics check cassette confirms the correct operation of the optical system and must be run at the beginning of each day before patient samples are tested and anytime after moving or cleaning the Cholestech LDX system. The optics check cassette should be kept in its case at room temperature when not in use and handled like all cassettes. Hold the cassette horizontally. Do not touch the reaction bar or the brown magnetic stripe. Keep it dry and clean, because if it becomes damaged or wet, the optical readings may change. When your optics check cassette has expired, or should it get damaged, please contact your local distributor. To start the optics check, press the Run button. The self-test may run at this point. If it does, confirm that it passes. The cassette drawer will now open, and you will see the words Load Cassette and press Run. Please note, if the sample type is set to hold B, the message will include W. If the sample type is set to serum, the message will include S. Put the optics check cassette into the analyzer and hold the cassette horizontally. Do not touch the reaction bar or the brown magnetic stripe. Do not place any sample into the optics check cassette. Press the Run button again, and the analyzer will automatically perform the optics check. Record the optics check results in the optics check log sheet, which can be found online or by calling the Abbott Technical Service Team. The results for the 4 channels should fall within the 80 to 105 range, and if they do, the analyzer is ready for use. If the numbers fall outside this range, the optics test fail message will appear. The analyzer will not be able to run a patient test until another optics check has been run that falls within range. Try running an optics check test with another optics check cassette. If the numbers are still outside the range, please call the technical service team. If an expired optics check cassette is used, the expired cassette message will appear. If an expired optics check cassette is used and then a test cassette is used, the expired cassette message will appear on the screen. If you are using the optional printer, an expired optics cassette message will appear after the test results. You should purchase a new optics check cassette immediately from your distributor. Part 5. Running liquid quality control material. In addition to the optics check, testing external quality control materials verifies that the system is functioning properly. As a reminder, medical gloves should always be worn when handling quality control material. Remove the control materials and test cassettes from the refrigerator and allow them to reach room temperature for at least 10 minutes. Once opened, the control vial is good for 30 days when stored upright at 2 to 8 degrees centigrade. When using a new vial, write the new expiration date on the vial after it is first opened by adding 30 days to the current date. Do not use expired control materials. The control expiration date will be listed on the vial label, on the outside of the box, and on the control assay sheet. Set the appropriate sample type setting in the configuration menu: whole blood for the multi-analyte controls, and serum for the calibration verification material. Remove the test cassette from the foil pouch, being careful not to touch the reaction bar or brown magnetic stripe. Press the Run button. The cassette drawer will open, and the message Load Cassette and Press Run will appear on the screen. Mix the control by gentle inversion. 7 to 8 turns are sufficient. Attach the pipette tip firmly to the mini PET pipette. Press down completely on the plunger and insert the pipette tip into the control material. Slowly release the plunger. The mini PET pipette will automatically draw up the sample. Make sure that the pipette tip remains in the control material the entire time you draw up the sample to ensure sufficient quantity is in the pipette. Dispense all of the control material directly into the sample well of the cassette by pressing the plunger. To avoid drawing control material back into the mini PET pipette, do not release the plunger until the pipette tip has been moved out of the cassette sample well. Hold the cassette horizontally. Do not touch the reaction bar or the brown magnetic stripe. Immediately load the cassette into the tray and press the Run button to start the test. The screen will indicate its progress as the test is running. When the test is complete, the analyzer will beep, and the results will appear on the screen. If the Cholestech LDX Analyzer is connected to its printer, the results will print at this point. Press the Data button to view any additional or calculated results on the screen. Depending on the test cassette, it may be necessary to press the Data button a third time to obtain all results. Abbott ships all control material with an expected values card, containing expected values for the control test results. Verify that the lot number on the vial and the expected values card match. Compare the results on the screen with those on the expected values card. Make sure each analyte is within its stated range. Then record the results in your quality control log sheet, which can be obtained from the Abbott website. If the controls are outside stated ranges, see your Cholestech LDX user manual for corrective action. Be sure to record all control results, even those that are out of range. Remove the cassette from the analyzer and discard it in a biohazardous waste container. The Cholestech LDX system is now ready for the next quality control test. Once the quality control check is complete, the control vials must be returned to the refrigerator and should be stored upright. If results for all levels of quality control material are within established ranges, patient samples may be tested. Abbott recommends that the quality control material must be tested with each new lot of cassettes, with each new shipment of cassettes, even if the lot has been received previously when reagents may have been stored or handled in a way that can degrade their performance, as required by your laboratory standard quality control procedures and as required by federal, state, or local guidelines. If your local or state regulations require more frequent testing of quality control material, then the quality control must be performed in compliance of those regulations. Part 6. Preparing to perform a test. The cassettes can be stored in a refrigerator between 36 and 46 degrees Fahrenheit, 2 to 8 degrees Celsius, or at room temperature. When stored in the refrigerator, the cassettes may be used until the date printed on the pouch. The shelf life on the test cassettes is shorter when stored at room temperature. Please refer to the package insert for specific dating on test cassettes when they are stored at room temperature. For small usage, remove the number of cassettes you will need from the refrigerator and check to make sure they have not expired. Before using cassettes that have just been removed from the refrigerator, the cassette pouch should be left unopened for at least 10 minutes to reach room temperature. Mark any cassette boxes that have come up to room temperature with a new expiration date. Part 7. Running a test cassette from a fingerstick sample. Once you've set up the system by running the optics check and external quality control material, you are ready to run a test. You will want to have prepared the following items prior to performing the fingerstick: the test cassette, lancet, capillary tube and plunger, alcohol pad, gauze, biohazard container, gloves, and a bandage. Have the participants sit in a chair next to the table with the supplies. The National Cholesterol Education Program, or NCEP, recommends that if possible, blood should be drawn in the sitting position and the patient should be allowed to sit quietly for at least 5 minutes before sampling. NCEP also recommends that blood samples for a fasting lipid profile should be obtained following a 9 to 12-hour period of fasting. If necessary, the patient can take water and prescribed medications during the fasting period. The American Diabetes Association recommends that blood samples for a fasting glucose test should be obtained with no caloric intake for at least 8 hours. If an individual is dehydrated, it may be difficult to obtain a representative blood specimen, especially by skin puncture. Individuals to be tested should be well hydrated. As a reminder, medical gloves should always be worn when performing a patient test. Prepare the capillary tube and test cassette. The plunger can be inserted into the capillary tube at the end with a colored band, prior to or after collecting the sample. Be careful not to push the plunger past the stopper inside the capillary tube. If you do, a new capillary tube should be used. After the test cassette has reached room temperature, open the foil pouch and remove the cassette, placing it flat on the table. Please note, the foil pouch should not be opened until you are ready to run the test. Remove the desiccant pack and discard along with the foil pouch. Performing the test correctly is essential to getting accurate results, and this involves the following key steps. Prepare the test site. Collect the blood sample. Transfer the blood sample to the test cassette. Run the test. When preparing the test site, choose a spot that is slightly off-center of the ring or middle finger pads of either hand. The fingers and hands should be warm to the touch. You can help ensure adequate blood flow by rinsing the hand with warm water, by applying a warm compress to the hand for several minutes, or by gently massaging the finger from the base to the tip several times to bring the blood to the fingertip. Clean the site with an alcohol pad. Dry thoroughly with a gauze pad before performing the fingerstick. Perform a firm and deep puncture. Squeeze the finger to obtain a large drop of blood. Wipe away this first drop of blood as it may contain tissue fluid. Squeeze the finger again until a second large drop of blood forms. Do not milk the finger. The puncture should provide a free-flowing drop of blood. Hold the capillary tube horizontally or at a slightly descending angle by the end with a plunger. Touch it to the drop of blood without touching the skin. The tube will fill by capillary action to the black mark. Do not collect air bubbles. If it is necessary to collect another drop of blood, wipe the finger with gauze. Squeeze the finger again until a second large drop of blood forms. Fill the capillary tube within 10 seconds. Wipe off any excess blood from the finger and give the individual a gauze pad to put pressure on the puncture site until the bleeding stops. Here are some important tips to consistently ensure successful testing. Don't milk the finger. Milking the finger is squeezing the finger while pulling the blood towards the puncture site. This can cause interstitial fluid to get into the sample and potentially cause inaccurate results. Don't hold the capillary tube at an overly ascending or descending angle. This can increase the time necessary to fill the tube and may lead to clotting or an air bubble in the sample. Don't continue to try to fill the capillary tube if the fill time is more than 10 seconds, as this could lead to clotting of the sample. If a problem does occur, discard the capillary tube and collect a new sample. If an air bubble is noticed in the capillary tube, discard the sample and fill a new capillary tube. Air bubbles can cause a short sample situation where the test cassette may not be able to perform properly. Now that you have successfully collected the sample, you're ready to run the test. Open the tray of the analyzer by pressing Run. To transfer the sample to the cassette, first you must apply the sample to the sample well area of the cassette by pressing the plunger down until the entire sample is expelled. Dispense the sample towards but not touching the white filter in the sample well. The cassette should immediately be loaded into the analyzer drawer. Hold the cassette horizontally and do not touch the black reaction bar or the brown magnetic stripe to ensure proper functioning of your analyzer. Press the Run button to close the drawer and the test will start. Bandage the individual's finger at the puncture site and wait for the results. Be sure to dispose of all supplies contaminated with blood in a biohazardous waste container. As the test is running, the progress will be indicated on the display screen of the analyzer. When the test is complete, the Cholestech LDX Analyzer will beep, and the result will appear on the display screen. The tray will open, and the completed test cassette can be discarded in the biohazardous waste container. If the Cholestech LDX Analyzer is connected to its printer, the results will print at this point. Press the Data button to view any additional or calculated results on the screen, and record them on the patient result form if necessary. Depending on the test cassette, it may be necessary to press the Data button a third time to obtain all results. After a test has been performed, pressing the Run button once brings up the prompt to load a new cassette and start a new test. Pressing the Stop button will close the tray, or it will close on its own. Call the technical service team if there are errors in testing results or any other questions. Additionally, if any abnormal or questionable results are obtained while using the Cholestech LDX system, it is a best practice to run quality control materials to verify the system functionality. Part 8. Running a test cassette from a venous whole blood sample. In addition to fingerstick samples, venous whole blood samples can also be used with the Cholestech LDX system. Collect venous whole blood in a green top tube that will have a heparin anticoagulant. Use the appropriate mini PET pipette for the specific sample type with a specific test cassette. Firmly attach the pipette tip to the end of the mini PET pipette and be sure to use a new tip for each sample. To fill the pipette, push the plunger down as far as you can. Place the pipette tip into the sample and slowly release the plunger. Confirm that no air bubbles are in the pipette tip. Now that you have successfully collected the sample, you're ready to run the test. Open the tray of the analyzer by pressing Run. To transfer the sample to the cassette, first you must place the pipette tip into the cassette sample well. Dispense the sample toward but not touching the white filter by pressing the plunger down. Move the pipette tip out of the sample well before releasing the plunger again. The cassette should immediately be loaded into the analyzer drawer. Hold the cassette horizontally and do not touch the black reaction bar or the brown magnetic stripe to ensure proper functioning of your analyzer. Press the Run button to close the drawer and the test will start. Be sure to dispose of all supplies contaminated with blood in a biohazardous waste container. As the test is running, the progress will be indicated on the display screen of the analyzer. When the test is complete, the Cholestech LDX Analyzer will beep, and the result will appear on the display screen. The tray will open, and the completed test cassette can be discarded in the biohazardous waste container. If the Cholestech LDX Analyzer is connected to its printer, the results will print at this point. Press the Data button to view any additional or calculated results on the screen, and record them on the patient result form if necessary. Depending on the test cassette, it may be necessary to press the Data button a third time to obtain all results. After a test has been performed, pressing the Run button once brings up the prompt to load a new cassette and start a new test. Pressing the stop button will close the tray, or it will close on its own.